Good afternoon, everyone. We're thrilled to be part of this event. And I'll just say the Environmental Health Project believes that everyone everywhere should have the opportunity to live healthy lives free of pollution from oil and gas development. Um, so that's what we're going to be focusing on here today. We're happy to be back with Grassroots Environmental Education for this follow-up to a very successful webinar we co-hosted last fall. If you joined us for that event in October, you may remember that we addressed the connection between poor air quality and adverse health impacts, as well as the necessity for understanding where and when pollutant exposures occur in order to better protect public health. During that event, to present some of the tools and approaches available, we heard from federal, New York State, and nonprofit representatives about their approaches in gathering air quality data. If you weren't able to join us for that event, or if you'd like a refresher, we'll be putting links in the chat. So feel free to watch the recordings and read over the Q&A at your leisure. But because of the positive response we got from the last webinar, we're teaming up again to bring you the next piece of the puzzle. EHP has been serving the region for over a decade, and a common question we hear after gathering air quality data is, now that I've got this information, what do I do with it? So today, we will be highlighting and discussing ways to convey exposure information and health consequences to key stakeholder groups, including policymakers, public health professionals, healthcare providers, and community leaders. Local information, whether air quality data or community member experiences, is critical to successful education and advocacy. So for the event, we're going to start off with our panel of presenters who will cover approaches in bridging gaps in standard air quality issues. We'll be translating available science into more effective health and wellness advocacy. And you'll also hear a success story from a frontline community enabled by dedicated volunteers. There will be time for a brief Q&A after each of the presentations, so please keep putting your questions in the chat as you think of them. We'll be monitoring and we'll ask as many as we can in the time available. And then around 2 o'clock, we'll move forward into our breakout discussions to talk more about some of these tools and approaches in depth. And we want to be hearing from you during these sessions. What are your questions and concerns? Where have you seen successes or obstacles to implementation? The more robust these discussions are today, the better prepared we'll all be to support public health efforts in the face of poor air quality, particularly poor air quality as a result of oil and gas development. Most of you have already signed up for a breakout room. When you registered for the event, those will focus on policy and advocacy initiatives, health and wellness education, and data and collection analysis. And we'll refresh your memory when we get to that part of the event, but there will be an EHP team member leading the discussion in each of those groups. And if you didn't have a chance to ask a question during the presentation portion, you can get another chance to discuss in the breakout room. And then finally, around 2:30, we'll come back to the main room and debrief from our conversations before we wrap up for the day. And just once again, I want to say how thrilled we are to have you all here for this important interactive learning event. So I am going to hand it off to our first presenter, Nathan Duran, who is EHP's policy manager. Nathan earned his Bachelor of Science in Political Science and Sociology at the University of Pittsburgh, and his Master of Science in Public Policy Management and Data Analytics from Carnegie Mellon University. He's been with EHP since early in the pandemic, making our analyses more insightful and our tools more accessible, and I am happy to hand the microphone over to him.
Thanks so much, Allison. It's great to be with you all this afternoon. Hopefully everyone is seeing some slides right now. If I can get a thumbs up from Allison, perhaps, if you can see slides. Thank you, Allison. As Allison mentioned, my name is Nathan Duran, and I'm the program manager here at EHP. And this afternoon, I'm going to be talking to you a bit about the health impacts of shale gas pollution specifically, and how existing information sources can help us understand and communicate the impacts of that pollution on air quality and the health of people in the state. Many of these takeaways can be applied to other sources of pollution, but as Allison mentioned, we focus largely on oil and gas development. And there we go. So a brief overview of what I will be covering. First, I'm going to give a brief introduction to our organization for those of you not familiar with EHP, dive into shale gas infrastructure in New York, what that looks like, then talk about the health impacts of that infrastructure, go into information sources of air quality data, and talk about gaps in that data and the protections that it allows us. Lastly, as has been mentioned, we will open it up for a brief question and answer period. So the Environmental Health Project, for those of you not familiar with EHP, we are a public health nonprofit organization that provides wide-ranging support to communities impacted by oil and gas development. We started out in McMurray, Pennsylvania, outside of Pittsburgh in 2012, and now provide services to impacted communities across the country. We seek to support communities in understanding the exposures and risks generated by oil and gas development and engage in policy dialogues at the local, state, and national levels regarding the public health implications of oil and gas activities. That support includes environmental monitoring, data and research interpretation, health impact assessment support, and public health guidance. The strength of our organization lies in our direct contact with community members, learning about their circumstances, and responding to their need for relevant information and guidance. So why are we talking about shale gas infrastructure in New York State specifically? As many of you likely know, the state has banned the extraction of shale gas through the process of fracking for quite some time now. However, that does not mean that there are not pieces of related infrastructure in the state. Namely, these four kinds of infrastructure pictured here, which from left to right are compressor stations, interstate gas pipelines, gas-fired power plants, and underground gas storage facilities. All of these, even though they are not extraction of gas, can have real impacts for folks that live near them. To give you an idea of the scope of the shale gas industry in New York State, here is a map that shows those four different kinds of infrastructure throughout the state. We have our gas power plants as those blue triangles that are mainly located in New York City and on Long Island, but throughout the state. We have compressor stations, which are more evenly distributed around the state. Those underground gas storage facilities, those orange crosses, are all in the western half of New York. And then interstate gas pipelines as those purple lines on that graph. So this really is an industry that is impacting folks across the state of New York. So why are we talking about the health impacts of shale gas development? Well, there are lots of impacts that folks that live near these kinds of facilities, the kinds of facilities we see in New York State, there are a lot of impacts that those people are seeing and is shown in the literature and in our work. From this kind of source, as well as almost any source, there are three main pathways of exposure to pollution. Those are through the air, through the water, and through the soil. Here today, we're going to be focusing on air exposures. That is the most relevant to the facilities present in New York State, and also one of the more straightforward to measure and understand and communicate about. When we're talking about air exposures to pollution, we are talking about two main kinds of pollution when discussing shale gas. So that's going to be particulate matter, or PM2.5. Specifically, that is fine particulate matter, which is very small pieces of stuff, for lack of a better word, that are so small that they can make it all the way down into your deep lung. These are particulates that come from a wide variety of sources, such as combustion and wildfires, but also the interactions of other pollutants in the atmosphere. This is the most important pollutant globally for human health impacts. Second, we're very concerned about volatile organic compounds, or VOCs. VOCs are a diverse set of gases that range from unpleasant to incredibly dangerous. VOCs go on to form ozone in the atmosphere, but exposures to VOCs before they undergo that transformation is one of the main concerns surrounding the sorts of facilities we're discussing. So when somebody is exposed to this kind of pollution, when talking about air pollution that is largely through inhalation, we are then also thinking about how different people, how different communities, and how different populations are going to react to that differently. And some of that is based on their exposure, right? How long have they been exposed to this pollution? How frequently are they exposed? Also, how toxic was that pollution? This is important with those VOCs, right? Since there's a wide variety of them, are they being exposed to something that is more dangerous or on the less dangerous side of the scale? Also, we think about aggregate emissions, right? So is somebody in a situation where they're already exposed to a lot of environmental pollution or indoor pollution that is going to, any new source of pollution coming from shale gas development or anything really is going to go on top of that. And that is something that is very important to consider. We also think about the vulnerability of an individual, right? So this is whether or not that individual is going to be particularly susceptible to the health impacts that this pollution brings with it. These are things like, are they a child? Are they elderly? Are they pregnant? Do they have pre-existing health conditions like COPD or asthma? These are very important when thinking about the individual exposures and the ensuing health effects. As you can see here, there's a variety of short-term health effects that we see coming from shale gas pollution exposure specifically. They range from things like stress and irritation of the eyes, nose, throat, and skin to short-term memory impairments and adverse effects on developing fetuses. With repeated or prolonged exposure, we see there are also long-term health effects. This includes worsening of pulmonary or heart disease. This includes the development of asthma and things as serious as cancer. So this is something that we are very concerned about, and this is why we are discussing it as an organization and using it as an example here today. So when trying to understand air quality for a particular area, there are a bevy of existing information sources out there. The ones I have listed here are all government sources of information that allow us to understand air quality in a particular area. So airnow.gov provides information from regulatory monitor networks that are available from the state, in this case, the state of New York, under supervision from the EPA, according to the Clean Air Act. And we'll get a little further into airnow.gov, but I want to highlight here that they do have email alerts that are available to you to use, and their fire and smoke map as well provides some additional information sources that we'll get into. There's also information available from the New York DEC, which is your state environmental regulator. This data set includes whether or not any particular area is within attainment of the National Ambient Air Quality Standards. This is the main way in which air quality in communities around the country are regulated and measured. There is also the regulatory monitor data collected by the state is available in real time at nyaqinow.net. We have two other tools here on this list. One is EJ Screen. This is an EPA tool that provides access to various environmental justice metrics that includes poverty, demographics, and access to healthcare, as well as environmental indicators like long-term average air pollution levels, proximity to Superfund sites and hazardous waste facilities, and exposure to things like diesel exhaust. CDC Places, meanwhile, is published by the Centers for Disease Control and provides access to granular community health information. This includes rates of chronic health conditions like asthma, COPD, and coronary heart disease, as well as access to and utilization of preventative healthcare services in those communities. So this helps us understand additional risks that a community might face from air pollution exposures that we can understand through the other tools. So as I said, we'll dive a little further into airnow.gov. This is really the best interface that I know of to be able to get a quick understanding of what your local air quality is looking like according to the regulatory monitoring networks. So this site allows you to see the air quality index, or AQI, which is a relatively straightforward and easy to understand definition and determination of the quality of your air. You can simply put in your zip code, your city or state, and it will take you to this interface here. There's also an output, which gives you a map of air quality and shows you how that air quality index has been determined. So air quality index is generally determined by ozone and PM 2.5. Sometimes both of these are not necessarily available in an area, and it's determined just by one of these. You can also see on airnow.gov an air quality forecast. Sometimes these are forecasted out a little further than in this example, but this does allow folks to understand and plan out their activities a bit based on anticipated air quality in their area. Lastly, I had mentioned the fire and smoke map. This is a good interface where you can see those regulatory monitors on a map and see what they're reading at any given time. But additionally, this brings in low-cost monitoring data from a manufacturer called Purple Air that makes PM 2.5 monitors that communities can deploy and puts it in the same place. So you can see if a closer monitor that isn't a regulatory monitor might be saying something different. When there are impacts from wildfires as well, those wildfire plumes, the smoke plumes from those wildfires, get put on this map as well, so that you can understand whether or not your community is being impacted by wildfire smoke. So this is good, high quality data, right? And the state of New York does a good job of gathering this information, but that doesn't mean that there aren't gaps in the protections that these data sources provide us. Namely, in our ambient air quality monitoring networks, there's an issue of density and the pollutants that are being monitored. So because this is high quality data and being done in a very regimented way, there regulatory monitor sites are expensive and few and far between. Pollutants measured as well, as I mentioned, we are very concerned about VOCs when looking at shale gas infrastructure, but we don't have all that many regulatory monitoring sites that measure VOCs specifically. We also lack source-specific monitoring information in a lot of circumstances, publicly available source-specific monitoring information, I should say. A lot of monitoring information that is specific to sources is submitted to the DEC on a delay and then needs to be obtained either through a FOIA request or a documents review. So that can be difficult in trying to understand quickly what is going on near a specific piece of infrastructure that could be emitting into the community. Lastly, there's this issue of operator self-reporting, and the main concern with that I want to call out is that when operators report their emissions to regulators, those emissions can be based on things other than monitoring, right? It can use things like emissions factors where, for instance, the amount of gas used is put into an equation that gets them an amount of emissions. So the self-reported information from operators has the opportunity to not necessarily reflect the truth on the ground. So bringing us back to this map of the state and where shale gas infrastructure specifically is, we can see here with these yellow teardrops that this is our regulatory monitoring network, which does have some gaps in it geographically, but I will say in terms of the states that we tend to work in, this is one of the better monitoring networks out there. But that doesn't mean there aren't gaps, right? It's sort of definitional to how this work is done. And if we look specifically at the monitoring sites that are measuring VOCs, also known as air toxics, as the EPA refers to them in this situation, we can see that we are whittling this down to these monitoring sites with large gaps in monitoring where we don't have a regulatory monitor looking at VOCs. So that's just to highlight some of those gaps that we just discussed. Circling back here, all of these gaps are not necessarily something that can be fully fixed by regulators necessarily, but I do want to say that there are a lot of benefits to measuring emissions and communicating risk at a local level, whoever ends up doing it, right? That local information that's generated for communities is much more applicable to their lives. If the nearest regulatory monitor is 50 miles away, having a monitor on their house, right, is going to be a lot more applicable to their daily lives. It's a lot more actionable as well. When you have information that applies to your life, you're able to take action on that data in a way that you can't necessarily be sure of when you're using data that's from farther afield. And lastly, it can be more impactful. So if you're deploying local monitoring networks and understanding risk around a specific facility, that really empowers communities to advocate for greater protections from that source, either from the operator themselves or using the regulatory framework. So that's one of the reasons that we're here today, is to discuss these kinds of tools and approaches. And Taylor is going to talk about that more in our next segment. But for now, that is what I have to share with you. And that brings us to our brief question and answer period. So with that, I will open it up.
Thank you, Nathan. And just a reminder to everybody who's watching, please continue to put your questions in the chat. First one, Nathan, and I think we'll only have time for one or two quickly here to keep moving along in the agenda. But the first one, Nathan, how are the locations of state monitors determined?
There's a lot that goes into how those locations are determined. All of it is outlined in the State Monitoring Network Plan, which is submitted to EPA every summer. So you can go and read that document and comment on that document if you would like about how those locations are determined. There's a variety of different reasons that monitors get placed. Most of them are for that ambient air monitoring that I discussed. And for that, they are generally looking to have a pretty good coverage of area. They're looking to put monitors where there are people, right? So population density plays a large role in where these monitors get placed, and concurrently the gaps in those monitoring networks, as well as where they expect to see the most pollution. So, it does make sense when you lay it out that way, but the fact that there's only a finite amount of resources that can go into these monitoring networks really means that places that are more sparsely populated very often do not have regulatory monitors near them.
And just a quick follow-up to that, you mentioned earlier in the presentation the impacts of other pollution sources that are already in the area. Are nearby emitters considered in the permitting process for a new oil and gas facility?
Well, the short answer is it depends. Largely, it depends on the scale of that facility. So if the facility is a Title V facility, the largest kind of emitters regulated under the Clean Air Act, then there is a requirement for air pollution modeling, which does take into account existing sources nearby. However, for smaller sources, many compressor stations, many storage facilities, for instance, the requirements are lower, and mostly what folks are looking at in those kinds of permits are whether or not the area that a new facility is going into is within attainment of the National Ambient Air Quality Standards. If you're in a space that is outside of attainment of those standards, then you will have more rigorous requirements for your pollution controls, for example. But there isn't as much, work going into characterizing other nearby pollution sources.